Hello, this is a prenatal core class. My name is Krista Norwick. I am a pelvic physiotherapist, and today I want to teach you some great core exercises that you can do during pregnancy. They might be better in first and second trimester, but you might still feel like you can do them in third. When in doubt, ask your pelvic physiotherapist. Okay, you're going to start in a hands and knees position. You can do fists if your wrists are sore, or flat hands if your wrists feel okay. And then what you're going to do is you're going to work on belly movement. So as you inhale, see if you can let your belly completely hang. As you exhale, see if you can draw your lower abdominals up towards your spine, drawing your belly towards your spine. Inhale, relax your belly, let it hang. Exhale, draw it back up. Good. Repeat. Inhale, hanging your belly, relaxing as much as you can. Exhale, drawing up. Good. Keep going. Being able to relax your core is just as important as being able to contract it. So I want you to keep that in mind throughout this exercise class today. You want to be able to relax your belly and your core in between each rep. So really focus on that relaxation, letting your belly hang as you inhale, and then drawing up through your lower abdominals, so the space between your belly button and your pubic bone on the exhale. Great. On your next exhale, you're going to lift your right arm up. Inhale, returning to the start, relaxing belly. Exhale, activate, lift your left arm straight forwards. Inhale, relaxing your belly. Exhale, activate, lift right arm. Inhale, relaxing. Exhale, activate, lift left arm. Inhale, relaxing. You'll see that you're relaxing between each rep here. This is an important one because during pregnancy, it can become harder to activate your core while moving your arms. So really focusing on that. With any of these moves, if they don't feel right for your body, or if you can't do them while maintaining your core contraction, then please skip them. You can always come back to that first one where you're just working on your belly movement with breath. Final arm lift here, bringing your hand back as you inhale and staying here in hands and knees, taking a break, so really letting your belly relax as you breathe in. Option 2, go onto your fists if your wrists are getting sore. The next one we're going to do is going to involve leg movements. As you exhale, lift your right knee to the side. Inhale, relax. Exhale, lift your left leg out to the side. Inhale, relax. Exhale, lift your right leg out. Good. So as you're doing this, it should almost look like when a dog lifts their leg to pee on a fire hydrant. We call these fire hydrants often. So you're lifting straight out to the side. So what's really important here is in between each rep, you can still relax your belly. And then when you're doing the movement, your spine and your pelvis is staying still and you're not feeling any pain. So like I said, if this feels painful at all, skip this one, go back to the easier version, arm lifts, or just movement with breath. Last leg lift here. Great. After that last one, go into child's pose for a rest. Nice big deep breaths here. Depending on where you're at in pregnancy, you may need to widen your knees so there can be more space for your belly. So play around with this if you need to, and see if you can fully relax your core. Good. You can come back to hands and knees. We're going to transition to the next one here. So same movement with breath. As you inhale, relax. As you exhale, you're activating. And then lift your left leg straight behind you. Inhale, return to the start, relax. Exhale, activate, lift your right leg straight behind you. Good. So same thing with the fire hydrants. You're trying not to let your spine or your pelvis move as you do this, staying as steady as you can, making sure you can relax between each rep and that you can maintain that core activation as you lift. option, as always, to have your fists on the mat instead of flat hands if your wrists are bothering you. Really focusing on activating your lower abdominals, drawing your lower abs towards your spine. Great work. Taking a break, rocking back into child's pose. Trying to relax your belly completely. Nice big deep breaths, giving your core a break. Like I mentioned before, it is just as important to relax your core as it is to activate it. Slowly rock back out of child's pose, coming to hands and knees position. Now, this one is going to be the most challenging one. You're going to lift opposite arm with opposite leg. This one often is too hard during third trimester, so just go back to an easier version. But if you can do it right now where you're at, make sure you activate your core as you lift opposite arm and leg, and then relax it in between each rep, remembering the relaxation is just as important. This is called bird dog. So you're trying to make sure your spine and your pelvis are staying still as you lift opposite arm and leg. If you can't do that, then this exercise is too hard for you, and that is completely fine. Just do an easier one that we already have done in this class. And then back into child's pose for a nice rest. Nice big deep breaths. Option here to reach your hands towards the top of your back if that feels good. Great, rocking back to hands and knees. And then this one is going to be half planks. So as you inhale, relax your core. As you exhale, activate that lower core, and then walking your hands forwards, letting your pelvis drop down. Return to the start on the inhale, relax your core, and then activate that core, walking your hands forward, and then back. Inhale, relax the core. Exhale, activate your lower core, walking your hands forwards, making sure your core stays engaged, and if it doesn't, either don't walk your hands as far or skip this one if you can't do it while maintaining that core activation. Great work. Trying to walk with your hands with as many little steps as you can. Maintaining that core engagement as you do that. Relaxing your core between each rep. Great, coming back into child's pose for another rest. Nice big deep breaths, relax your core. Great, coming back out of this position, and then we're going to do side planks next. So getting set up on your side, elbow right underneath your shoulder, knees right underneath your body, and see if you can make a line between your trunk and your thighs so you're lined up in a nice straight line. Bottom leg stays bent, top leg is straight, and then when you're ready, pushing your body weight into your elbow, lifting the side of your body up. So activating that lower core again, drawing your abs towards your spine. Your right knee is going to stay touching the ground, and your left leg is going to be straight. As you breathe here, you won't relax the core completely, but you might find there's a little bit of movement as you breathe, and that is great. Good. Resting back down and switching sides. So this time your left knee is going to be down, left elbow underneath your left shoulder, lifting your side. So bottom leg is bent, top leg is straight, drawing your lower abs towards your spine. Continuing to breathe. If you can't do this while maintaining your core activation, If this is too hard for you or if it causes any pain, then just skip it. Nice work. Resting down and then switching sides. This time you're going to lie right down onto your right side. You can use your right arm or a pillow to rest your head on. Keep your bottom leg bent and then roll your left pelvis forwards a little bit, but only as far as you can with your belly. And then with your left leg straight, extend it slightly behind you and then lift and lower that leg. The goal is that you're working on your glute muscle here. So you should feel it in the area that I'm pointing to now. Great work. Switch sides, exact same setup on the other side with your left side down, resting your head down. Bottom leg, your left leg bent, right leg straight, pelvis rolls forwards a little. Activate your deep core. Extend your right leg behind you a little and then lift and lower. The goal is that you're activating your glute muscles. So if you feel all the stuff on the front of your hip, then extend your leg back a little bit more. Nice work. This is the final exercise. You might find that some of these exercises continue to work for you throughout the entire pregnancy, and that's great. You can pick and choose what works for you as you move through pregnancy. Great work. You can switch back to sitting. Thank you so much for joining me today. Great work. I hope you have a great rest of your day.